Ms. Polly is a 67-year-old client who arrives at the clinic for a scheduled appointment with her primary care physician. Ms. Polly reports experiencing fatigue, frequent headaches, and nosebleeds. She also mentions feeling itchy after taking a shower. Based on these findings, a complete blood count, or CBC, is ordered to check her red blood cell count. Red blood cell count, also known as an erythrocyte count, red cell count, or just RBC count, is a part of CBC that measures the number of red blood cells in 1 cubic millimeter of blood. Now, red blood cells, or RBCs for short, are created by the bone marrow, which is stimulated by erythropoietin from kidneys or by a lack of oxygen in the tissue. Red blood cells carry oxygen from the lungs to peripheral tissues, collect the carbon dioxide there, and carry it back to the lungs, where it is exchanged for oxygen. The normal values of red blood cell count differ between sexes. This is because, in females, red blood cell production is stimulated by erythropoietin only, while in males, androgens provide additional stimulation for red blood cell production. So, in adult males, the red blood cell count ranges from 4.6 to 6.0 million per microliter, while in adult females, it ranges from 4.0 to 5.4 million per microliter. Alright, there are some conditions that can alter the red blood cell count. An increased red blood cell count can result from a condition called polycythemia. Polycythemia vera is one type of polycythemia, when the bone marrow produces an excess amount of red blood cells without being stimulated. Another type is secondary polycythemia, which is when the bone marrow is stimulated by additional erythropoietin or a lack of oxygen to produce more red blood cells. Alternatively, if the amount of fluid in the blood decreases, like with dehydration, the concentration of red blood cells increases, so the red blood cell count goes up. On the other hand, low red blood cell levels can be caused by a decreased red blood cell production, like in kidney disease, which decreases the synthesis of erythropoietin, bone marrow suppression, like in aplastic anemia, increased red blood cell destruction, which can happen if there is a deficiency of glucose 6-phosphate dehydrogenase, or just by the loss of cells, like with blood loss. Another way red blood cell count can decrease is fluid overload, where excess intravascular fluid dilutes the blood. This causes a relative decrease in red blood cells and is referred to as dilutional anemia. Also, during pregnancy, blood plasma increases more in relation to red blood cells, which causes a physiological anemia of pregnancy. Now, a client's red blood cells will be measured when there are signs or symptoms of low or high red blood cells. Symptoms of decreased red blood cells can include fatigue, weakness, pallor, cold extremities, tachycardia, palpitations, and chest pain. On the other hand, symptoms of increased red blood cells can include fatigue, dizziness, frequent nosebleeds, and itching after a warm shower. Additionally, red blood cells can be measured to assess a client recovering from surgery, as well as after an acute hemorrhage or episode of hemolysis. Finally, red blood cells are measured to screen clients who are at risk for anemia. Alright, let's look at the nursing implications for a client with an altered red blood cell count. The priority goals of care are to identify and treat the underlying cause and monitor your client's red blood cell count. First, collect a sample by venipuncture using a lavender-topped tube. This tube contains the anticoagulant EDTA to help prevent clotting of the sample. After obtaining your sample, remember to gently invert the sample several times to ensure the EDTA mixes with the blood, but avoid shaking the tube, as this will cause hemolysis, or breaking apart of the red blood cells, which will alter the results. Now, if your client has an increased red blood cell count, keep in mind they are at increased risk of thrombosis as the blood becomes more viscous. Ensure your client maintains adequate hydration and encourage activity to prevent venous stasis. Notify the healthcare provider if your client shows signs of thrombosis, such as sudden change in mental status, numbness or tingling on one side of the body, blood-tinged sputum, chest pain or swelling in one leg. If your client has polycythemia vera, perform therapeutic phlebotomy as prescribed to achieve a normal red blood cell count. On the other hand, if your client has secondary polycythemia, focus care on monitoring pulse oximetry, correcting the underlying cause of hypoxia, and counseling on smoking cessation if needed. Also, administer the prescribed IV fluid replacement if your client is dehydrated, as well as medications like antihistamines to decrease itching. Okay, if your client has a decreased red blood cell count, keep in mind that they might also be fatigued and weak, so be sure to institute fall precautions and provide breaks in between care activities to help them rest. If your client's condition is caused by a deficient diet, ensure there is a referral for a dietary consult. Then administer packed red blood cells as prescribed. In situations where your client is losing blood, monitor them closely for signs of continued bleeding and report signs of shock like hypotension, tachycardia, or dyspnea to the healthcare provider right away. Finally, for any client with an altered red blood cell count, be sure to check your client's history for factors that can interfere with red blood cell count lab results. For instance, elevated red blood cell levels can occur after living in a high altitude for an extended time